This book, Achieving Zero Hunger in India, is an outcome of the project called Spandan, sponsored by Gates Foundation and housed at Algeria. The objective of the Spandan project is to understand the research on agriculture and nutrition, linkages between agriculture, nutrition and health in India, and also focus on SDG targets, particularly SDG 2. It's edited by me along with my colleagues IGADR, Dr. Ganesh, Kumar, Dr. Vijayalakshmi Pandey. Dr. Vijayalakshmi could not come to this function, and it's published by Springer. So I thank Ms. Nupur Singh for the initiative in publishing this Springer book. The studies included in the book were commissioned by IGADR either through invitation, some are through invitation, some are through open advertisement. Been advertised in UW and other places. And each of the studies were presented in 3 workshops and reviewed by experts at different stages. Coming to the challenges, I already mentioned in my presidential address the Zero Hunger, the SDG 2 goals. There are several challenges, like still 16% are undernourished according to FAO calculations in India, and we have calorie deprivation, protein deprivation, and hidden hunger called micronutrient deprivation. And second, anemia is very high among women, particularly among women and adolescent girls. And malnutrition among children is also high. And as I mentioned, the 75% of Indians can't afford healthy diet, according to FAO. And obesity is also simultaneously is increasing. So it may be difficult for India to achieve, the SDG 2 goal on zero hunger if we act as business as usual, unless we make more efforts in reducing this hunger. So we have the chapters in the book, we will give the details, but they are grouped into 5 broad areas. One on the concepts, the food security, nutrition, hunger, concepts and measurement. Second, status of food security in the poorest part of India. We also have food security atlas, Bihar and Jharkhand thing. Dr. Alak Sharma is not here today. IHD prepared those food security atlas. And then third is cross-sectoral impacts on nutrition. Because malnutrition subject is that we need multi-sectoral approach. Fourth one is gender dimensions of health and nutrition. The lastly, interdisciplinary perspective, because that is important for this nutrition and food security issues. So while being rooted in economics, the book takes a multidisciplinary approach, covering agriculture economics, nutrition, crop sciences, anthropology, law. So these are the brief about the book. So with this, I request my colleague Dr. Ganesh Kumar to give a detailed presentation on the about the details of the book. Thank you very much.
Good morning, and first of all, let me thank the organizers of this conference for inviting me to present this book. My Professor Mahendra has already provided an overview of the book, and so this is as he said, it's an open access book, and the link is mentioned here. And these things he has already talked about, so let me not spend time on it. And as he said, there are 11 contributed chapters in this book, organized in 5 themes. What I will do is I will go theme wise, and then I will give a brief flavor, very brief flavor of each of the chapters. Okay. In the first thing on food security, nutrition, hunger, the policies, concepts and measurement, we have two chapters which are mentioned here. One is by Manoj Panda and the other one is by Mohammed Zakaria Siddiqui and Dawud Rahman. These two chapters basically touch upon the policy, give the flavor of the policy history and well more into the concepts of food security, nutrition security, etc. So, to begin with, the chapter by Manoj Panda actually reviews the India's policy response to the challenge of hunger, nutrition and food security starting from the Green Revolution onwards. It also looks at various concepts related measurement issues that have guided the policy, such as calorie norms and so on and so forth, related issues of poverty and so on. He then briefly looks at the achievements and challenges that the country faces, and some of the important things that he comes up with is that he finds that broadly speaking, the macro and micro level policy interventions have had the desired effect. It has helped the country achieve significant progress in food availability, food nutrition security at the national and to a large extent even at the individual level. It's not to say that we have solved the problem at the individual level completely, but to a very large extent we have kind of made significant progress in that. However, what he points out is that the achievements have come at an extraordinary cost. Cost in two terms. One is the fiscal side. Fiscal cost of the various programs are enormous, and also in terms of cost of the natural resources that have gone in, and especially water. And there was even a paper today in the session on water use in Punjab, which highlights the problem. Water use efficiency has been an issue in the country, and these are some of the costs that the country has paid to achieve food security. And in that context, he calls for a need to evaluate policy alternatives. There is an enormous, whatever policies we have been following without actually giving a thought on whether there are better alternatives that we could have looked at, whether there are alternatives that we can at least now pursue. Okay, but that kind of evaluation is not happening. In the chapter by Zakaria Siddiqui and Rahman, what they do is that they actually hypothesize that the country, when you use a minimum dietary energy requirement at a national level, it can give rise to certain accounting fallacies, and they say that that could be one of the reasons for the lack of correlation that people have pointed out between calorie intake deficiency and anthropometric outcomes. Okay, that's on one side, and also the prevalence of undernutrition in states that are supposedly advanced in economic terms and in also on some of the health metrics. So people have pointed out this lack of correlation, and these two authors come up with the hypothesis that it could be because of using a nationally determined FDER. What they argue is that there is spatial variation in the environmental and contextual factors, such as the epidemiological environment, the health infrastructure, the level of the economy in the state, and therefore the extent of mechanization in the state. And these could have an important effect on the calorie requirements. And therefore, to use one single national MDR could be creating a problem, measurement problem. There is also the biomedical literature which lends support to their argument. And so to establish this, they use the NSS data on consumption and also the sanitation, hygiene and housing condition surveys, and they estimate multi-level models to work out the state-specific MDERs. Okay, what they find is that when they do this, the household level economic status, the female-headed households, age of head of household, access to PDS, availability of cultivable land in rural households, they all have a positive impact on the calorie intake. And household social religious status also matter, especially in rural areas. But if you look at the state level variables, when the state is economically advanced, it has a negative impact on the calorie intake. So their models bring out this very clearly. And so the prevalence of rates of infection also has a very positive relationship with the calorie intake. So given this, given these results, they then work out they compute the state-specific MDERs, and then they rework out the prevalence of undernutrition based on state-specific MDERs. And when they do that, they find that actually now the POUs are consistent with economic status of the state. And that's one. Secondly, there is also a significant correlation that they find between the anthropometric indicators and the nutrition status, except in the case of wasting. So they call for actually taking a relook at the calorie requirement norms that is currently followed. In the second part, which is on the status of food security in the poorest part of India, we have two chapters, both of which were written by Professor Alok Sharma and his team from IHD. Chapter 4 is on mapping the food security situation in Bihar and Jharkhand, whereas the chapter 5 looks at rural Bihar at a greater length. Okay. In chapter 4, what they do is basically they demonstrate the use of cartographic representation to locate areas where there is a food security problem. Food security is a serious issue. So for this, what they do is they assess food security on 3 dimensions: availability, access, and utilization. They use 15 indicators for use and draw data from secondary sources. It covers agriculture, it covers the social composition, urbanization, several household level factors are all taken into account in this analysis. Based on this, they work out separate indices for food availability, food access, and food utilization. Then they also work out the overall food security index, wherein they combine underweight children under age 5, women's body mass index, and anemic children in the age group 6 to 59 months. So based on this, they find large inter-district inequality across all 3 dimensions of food security. So they find that actually 22 out of 38 districts of Bihar and 14 out of 24 districts in Jharkhand appear in what they call as a priority list for policy action. And within this priority list, 8 districts in Bihar is what they classify as alarming, and they identify the districts where the situation is alarming in Bihar. And there are similarly in Jharkhand, there are 6 districts where the food security situation is alarming. What they then do is they identify critical variables where policy action is required in these districts. And what they find is the variable where the intervention is required is not the same everywhere. So that is an important message that comes out from this chapter. In chapter 5, what they do is they look at the food and nutritional security in rural Bihar over a long period from 1998 onwards, using the longitudinal surveys that IHD conducts. And they evaluate the changes in the household expenditure pattern on food over this 18-year period. And this they have also, to that they have added a telephonic survey that they conducted during the COVID times to see what happened during COVID. Food security is assessed using 4 indicators. I'm not getting into the details here. The broad conclusion that they find is that that the food basket needs to be expanded in Bihar. There is a predominance of cereals and vegetables in Bihar. The consumption of pulses, fruits, edible oils, milk and various other food that is rich in protein is very, very low in the state. And they find that 1/3 of the households actually consume only 4 out of the 12 prescribed items of food groups of items. So that's the stark problem that they identify in the state. What they suggest is that there is a what is needed therefore is, they say that the cropping pattern has to shift from cereals to millets and various other foods that is required to improve dietary diversity. They also find that migration has helped in improving the food security situation in general. But the same migration actually proved to be a bane during the COVID period, because it was the migrant households which actually suffered most during the COVID period compared to the non-migrant households. Okay, so during normal times migration actually helps, but when there are severe shocks that actually hit, then it is the migrants who are affected the most. They also find that there is significant scope to improve PDS and various other schemes such as the midday meal scheme, ICDS, water and sanitation. So these are
Ganesh, little bit faster.
Coming to cross-sectoral nutrition impacts, we have 3 chapters here. One is on the dairy sector. The second is on biofortification, that is the crop sciences, and the third is on crop insurance. In chapter 6, Brinda and her co-author look at the role that milk can play in the growth of children. They argue that milk is widely consumed even by vegetarians, and it's a source of animal source food which has good nutritional properties, and they therefore look at the milk consumption patterns and explore the nature of association between milk consumption and nutritional outcome for amongst the children, with a focus on stunting in particular. The data that they use is the consumption expenditure and NSHS4. What they find is that the modal frequency is 2 per day. There are differences between rural and urban areas in terms of milk consumption pattern. They also find that children of better educated mothers consume more milk, and the milk consumption rises with the wealth index. Other thing that they find is that breastfeeding is in general high amongst the children, but the breastfeeding declines slowly in rural area compared to urban area, and it declines much faster as the wealth index increases. They do some econometrics, most of which confirm these patterns, and they also show that milk consumption has a highly significant positive impact on the height for age scores. That is a stunting measure. Moving on, in the chapter by Alka Singh and her team, they look at how biofortification can help in bringing improving our health outcomes. And in that context, they look at what is the status of consumer awareness and willingness to pay. Okay, I will skip this details on the data, etc. What they find is that in general there is a modest improvement in stunting, wasting, and underweight children. Obesity and anemia are becoming the big problems. In general, northern and southern regions are better off compared to the east and the central parts, and also the western region. And mother's nutritional status and education are important variables that affect their child nutrition status. From a meta-analysis, they find that biofortification has a very good impact on nutritional outcome of women and children. For instance, the zinc intake through biofortified rice doubles. Even though the rice consumption does not increase, the zinc intake doubles. So that's the kind of advantage that biofortification can bring about. But they also find that Consumer awareness is quite low, less than 40% seem to be aware of it, and the willingness to pay is also an issue here. Creating awareness is important. Biofortified crops have to play an important role in overcoming nutritional problems. Moving on in chapter 8, Rashmi and her colleague Devashish, they look at how crop insurance can play an important role on health and nutritional outcomes. Their argument is that when there is a weather-related shock, it can force farmers to take certain kind of decisions which can be adverse in the long run, both for their earning capacity, but it can also affect their choices in terms of nutrition and health behavior, health-seeking behavior. And they say that crop insurance, which mitigates the losses, can actually prevent such adverse behavioral choices. So what they do is they combine secondary analysis and primary survey analysis, and they find that crop insurance and income support program provide a hedge against crop losses and has a positive impact on food security and healthcare seeking practices by women, especially in reproductive age, and therefore it has a positive impact on child nutritional outcomes. So there are these kind of cross-sectoral impacts which can also matter for nutritional things. So their detailed analysis shows that at the secondary level, they find that districts with higher cropping insurance show that the behavior is that they seek antenatal care, they are more likely to offer institutional delivery, they are more likely to receive postnatal care in private facilities. This is also substantiated by the private survey, which shows that households that receive PM Kisan report greater level of food security, the women seek high early antenatal care, and the children receive higher immediate postnatal care. So crop insurance and income support can have very good impact. In the fourth part, we look at the gender dimensions of health and nutrition, and here we have two chapters, one looking at the gender budget and the second looks at the intersectionality and how it affects women's empowerment and the intersectionality issue. In chapter 9, Indrani and her team, they look at gender responsive budgeting, and they ask whether countries that adopted GRB actually do better in terms of health outcomes, and whether the GRB adoption by India and what is its impact on health inequalities. So they use 4 measures, and their major finding is that increased health spending, overall health spending, and expanding universal health care actually is the one that really works, not so much GRB in health. Okay, they argue that that it is important to reduce the out-of-pocket expenditure, and that is what plays a very critical role in reducing health inequalities. And for this, you need to expand public health spending, and you need to expand the scope of universal health care. And a similar kind of a thing comes up in the Indian context also, and they find that intersectional inequalities have an important role to play here, and given the low levels of spending, what is important for India is to improve the health spending and expand UHC in a big way. Simantini in her chapter actually pursues the intersectional issue, but looking at the women's empowerment and how it affects the nutritional outcome. And she looks at the economic class and social groups and works out 10 intersectional categories. She looks at 3 indices of women's empowerment. Women's empowerment is defined in 3 different ways. And what she finds is actually that there are certain, the distribution of empowerment is not unimodal. One metric is bimodal and the others are multimodal, but definitely they are positively skewed. And the regression analysis brings out the aspect of sensitivity of the way empowerment is measured. Her findings is that the way you measure empowerment can give the kind of results that you get. And that is going to say that one needs to think of how to measure empowerment in certain, one needs to look at this measurement aspect more rigorously. Finally, in the fifth part, which is on moving on to interdisciplinary perspective, we have two chapters. One looks at food security from a legal or legal studies framework, and the other brings an anthropological light onto the issue of food security. In chapter 11, Kumar and Danya look at urban centers, urban poor, and what is the legal framework, what does it say on food security for the urban poor. And they argue that there is enough framework, but nevertheless there are inadequacies in the legal framework itself. And urban household, urban poor are the ones who are most often left out in the process. They look at this in the case of Gujarat, and they find they use methods which are common in the legal studies framework. And they find that the government programs are predominantly focused on rural poor. And as a result, the urban poor are left out. And they show it through the primary survey also, where they say that the urban poor are typically lack awareness of the government program. And especially migrants among them are the ones who are really left out of the whole system. They don't have access to various services, and what they suggest is that there is a need to expand the welfare programs, even the current welfare programs, to cover migrant workers in particular, because the legal framework for them is rather weak. And they suggest expanding the one nation, implementing the one nation, one ration card in a much more accelerated manner, creating awareness amongst the urban poor and also the migrants, and decentralized approach is what is critical. That is their argument. In the final chapter, Bindu brings an anthropological insight into the issue of food security. She argues that well-being is multidimensional, it is relative, it is subjective, and it is connected to one's attitude towards quality of life and life circumstances. And she says that, she argues that in societies where economic activities are collective, cooperative, then subjective and collective well-being are complementary to each other. So that's what she looks at, and therefore she examines the case of fisherwoman in Kerala using a primary survey. And what it brings out is that fisher livelihood is amongst the fisher folk is subsistence and based on unpredictable resources, the weather conditions in the sea and so on, fish availability and so on. The infrastructure, facilities, supportive environment, certainty in economy, access to non-economic resources, life experiences, all these affect the well-being of the fisher folk and women in particular, both at the individual level and at the community level. And she also finds that individual well-being is hugely influenced by support from family. Government interventions are important and they can play an important role, but they cannot substitute the family support in improving the well-being, the sense of well-being that fisher folk feel. And she argues that creating a positive attitude is vital for sustaining the aspirations, one's own well-being and involvement in a sustainable livelihood. So these are the broadly speaking, the findings of the various chapters. From this, the message that comes is that we need to review the calorie norms if we want more accurate measurement of the problem of hunger and food security. The interventions must distinguish supply side issues and demand side issues, and there needs to be proper targeting of the locations where the hotspot regions, and in this other sectors can also play a critical role. Dairy consumption and biofortification are tools for reducing malnutrition, can be very important. Other sectors, crop insurance and income support programs can also play an important role, even though these are not well appreciated, but they also do play an important role. Increasing public expenditure on health and making it universal is more important for the country. Decentralization is very important, and so also is family support. Okay. From the going beyond these 12 studies, the chapters in this book, some of the emerging literature also suggests that reducing post-harvest losses and food wastage is important to improve the food availability, and also make the food system more sustainable. One has to improve the access to good quality food, for which purchasing power has to improve, legal entitlements have to be enforced, and there must be genuine political will. People are also arguing now that there must be new institutions and frameworks for improving the trading systems and ensuring sustainable supply chains. There is also an argument that one needs to have, just as we have IPCC for climate policy, it is probably time for a similar institution that examines the crop sciences and for agricultural policies for food and agriculture. And finally, one needs to take an interdisciplinary approach to understand multidisciplinary perspective. In one of the chapters, the issues were brought about how a common MDR is a problem, but so also there is other insights coming from biology, which is talking of homeostasis and how that can also, so there is some emerging literature which is showing that how homeostasis as defined by the biologists can actually go on to show how the patterns of nutrition can explain the patterns of nutrition or malnutrition that we observe. So this is in a broad sense the gist of the book. I probably took more time than was planned. Anyway, the book is big and I hope you all get to have a look at it. This is the link to the book. Thank you.